Hi, my name is Dr. Brad Fackrell from Straight Chiropractic. Thank you for watching this workshop today entitled Treat or Trick, Understanding the Acid-Base Balance. Halloween is one of those holidays where our children get so much candy and they eat it and then they get sick, and most parents don't really like our kids to eat that much candy, but it just happens. And the purpose of this workshop is to help you understand why a child will get sick and really what does it do to their overall health long term. And of course that doesn't just happen for children, it goes for adults as well. And so the purpose of this workshop is to help you look differently and think differently when your child asks you if they can have that piece of candy. And really for you to think differently when you go to reach for that piece of cake or that ice cream or whatever it is, so that you can just ask yourself perhaps a different question. Is it really worth it? So enjoy this workshop.
So my challenge tonight is most people really like the foods that make you acidic. And that's unfortunate because it's detrimental to our health. And I'm one of those. So my challenge to you is to just look at Halloween, which is coming up in a couple of weeks, differently this year. And hopefully I'm going to give you enough information that if you were here at the Joy of Life workshop last month where we talked about thinking differently, hopefully you have some new tools to think differently about how you look at sugar and are able to make a different choice for your health. So this is, there are going to be a couple of articles that are going to be flashing up here. This is a medical doctor. She was very, very successful. This was, of course, a couple of decades ago, but she's an orthopedic surgeon in San Francisco. And she just had all these successes, and she was just one of she taught continuing ed courses. I mean, she was a very influential medical doctor in San Francisco and actually throughout the nation. And one day, something happened that changed her life, as it would for anyone when this happened. She noticed a little lump. Now, this month is Cancer Awareness Month. Well, she saw this little lump, and eventually it grew. It grew big. Now, let me ask you this. If you saw this growing on you, would you be concerned? Yes. Absolutely. Well, she was too. See, here's what happened. She went the typical medical route because she was a medical doctor. But what she found as she was going through her treatments, the people that were her colleagues were treating her like a number and like a patient, not as the colleague that she had been. And it was frustrating to her because she felt like she wasn't getting the attention and the care that she needed because this was important to her. It was her life. It was serious to her now. And what she realized is all those years as a medical doctor, she had not been giving the care and the service to her patients like she wanted to have for her. Well, the good news is she enlightened herself. When she didn't get the medical treatment that she really felt like she needed, she enlightened herself. And of course, she had all these people come to her and say, try this, do this. Fortunately, Dr. Lorraine Day, she now is arguably one of the most influential people advocating a healthy lifestyle to prevent and cure cancer. You don't have, she says, she wrote a book, Cancer Doesn't Scare Me Anymore. You can find her online. I encourage you to do some research, find that. If you know of anyone that has cancer, well, they don't have, as we talked about in our cancer prevention workshop 2 weeks ago, you don't have to go the typical medical route. You don't have to go through chemo and radiation. You can do what most people would call alternative, but really it's just what we were designed to do. You can eat different. And so, Linda, if you can just take a moment, can you just stand? I won't make you come all the way up, but can you just stand for us? was 2 years ago when Linda was diagnosed with cancer, and Linda is now cancer-free for 2 years, almost 2 years. Give her a hand. And she did it without any chemo or radiation or surgery. So it can be done. So if you have some questions, absolutely. If you want to chat with her afterwards, she is a celebrity in my book. You can certainly chat with her. She'd be more than happy to talk with you. So here's the key. Dr. Day, she realized there was a major flaw in the medical profession. Patients were viewed as objects, not as humans that can heal. It's really the allopathic or reductionist thinking versus holistic and vitalistic thinking. What that means is really it's the parts. They treat the parts, the symptoms, instead of treating the whole person. That's the difference. Or in other words, allopathy versus wellness. What I want to do is empower you more than ever to know that the power that made your body truly does heal your body. You just have to have the tools. You have to have the understanding and the information, and then you can make different choices. So much of medical intervention is unnecessary and harmful. The problem is that it appears necessary because people are so chronically sick due to living a genetically incongruent lifestyle. People have decreased immunity from poor living habits, which causes increased infection rates. Rather than addressing the cause, medicine treats the infection, the part, with antibiotics. Anyone care to tell me what the cause of cancer is? Anyone? Just go ahead, Kristen. Unhealthy habits, good. That causes the thing to happen, which is the cause. Michelle, do you have any idea?
An acidic environment.
An acidic environment is part of the problem. Yes, it does create this. Those of you, go ahead.
Mineral deficiency.
Okay, mineral deficiency could be part of this. Dusty? Free radicals is part of it. Go ahead, Jessica. What was that? Toxicity. Toxicity and deficiency are the two causes of cancer. In order to, so all those things, the mineral deficiency, all those other things, they're caused because of toxicity and deficiency. If the cells aren't getting what they need, you'll be deficient. And if they're getting too much of something that are causing toxicity, you will get some kind of a disease, period. So cancer is caused, just like heart disease, just like almost every other disease is caused from toxicity and deficiency. You see, what happens is each one of us is made up of trillions and trillions of cells. Each of those cells has innate intelligence. The innate intelligence, it knows exactly what to do for those cells to keep them healthy. If something goes wrong and you get a symptom, it's not an error in innate intelligence. Innate intelligence is just what it says, intelligent. It's very smart. It's an error in lifestyle habits that creates that, and then it's an expression of the cell or the gene that causes the problem. It's not genetics that is the problem. Although our genes have hardly changed, our culture has been transformed almost beyond recognition during the past 10,000 years, especially since the Industrial Revolution. See, too many people believe in the false doctrine that it's bad genes that makes us sick. And I'm here to tell you it's not. And many of you are shaking your head. You agree with me. And if you have questions on that, feel free to chat with me later. I can direct you to some good books and some information where you can find. I mean, it's so wrong to think that our genes are what makes us sick. It's the expression of those genes. That's what makes us sick. The major killers like cancer, heart disease, obesity, and stroke, and the major chronic illnesses like depression, anxiety, fatigue, etc., have never been shown to be genetic disorders. In fact, the incidence of these illnesses has been steadily increasing for years, yet our genes have not changed. Also, animals taken into captivity develop similar illnesses within a few years, and this certainly cannot be to genetic changes. Anyone ever seen an overweight cat or an overweight dog? Is that bad genes? No, that's because they're not getting enough exercise and they're eating too much, period. That's what it is. So why would it be any different for people? The cause of all sickness and disease is toxicity and or deficiency. Our innate intelligence is striving every minute of every day to create balance. See, we are an ecosystem. Each one of us, we live in an ecosystem, but inside each one of us is our own ecosystem. My question is, if we are an ecosystem, if all your cells are functioning in what's called homeostasis. Homeostasis is the balance of the body, all the cells working harmoniously together. If all of our cells are functioning in homeostasis, is it possible to be sick? Yes or no? Absolutely not. We cannot be sick. See, what happens is we go into what's called allostasis. That's when sickness occurs. Allostasis is when there's a new balance. Then the balance is an adaptation based on the environment that those cells are having to live in. So bottom line is, if you eat garbage and get sick, is it a healthy response or is it a sick response? It's a healthy response, isn't it? If you eat garbage and you have symptoms of sickness, that's a healthy response. That's your body trying to save yourself in spite of what you're doing to try to kill yourself. That's the key. In order to have optimal health, we must actively promote balance, not destroy it. We must stop eating garbage. We eat toxic and deficient diets and live toxic and deficient lifestyles and just keep looking for more toxic drugs to alleviate the signals our bodies are desperately sending in attempts to convince us to change our ways and save ourselves. You see, what I want to do is show you that eating a toxic diet will very slowly kill you, but I also, more importantly, want to empower you to be able to do something different, to make necessary changes. Because as I was talking with Helen Stelmar just a half hour ago, she was talking about life is about vitality. It's about experiencing the greatness of life, which we'll talk about more in a moment. So this just shows for those of you who have not read much or anything about the acid-base balance, there's a continuum going from 0 to 14. 0 is very, very acidic. 14 is very, very alkaline or basic. 7 then would be right in the middle, right? For those of you who love math. 7 is right in the middle. That's very neutral. So we're going to talk a little bit more about this. Just as your body temperature is rigidly regulated, the blood and tissues must be kept in a very narrow pH range, which is mildly basic or alkaline, which is actually 7.365. That's where your blood does almost anything possible to be able to keep it there. The body will go to great lengths to preserve that, including wreaking havoc on other tissues and systems in order to create that. Let me explain. Acidity is a major stressor to the body and puts it into an alarm reaction or emergency survival mode. As changes in pH are immediate threat to survival, the innate intelligence of the body will take whatever measures possible to return pH levels to a homeostatic level. Remember, we want homeostasis. We don't want allostasis. So if the blood pH, for example, was to go below 7.365, the body, the innate intelligence of the body has to respond, or else you will die. So it responds very strategically. When our long-term health is not the concern when you're in an acidic environment, short-term survival is. What happens is when our lifestyle causes the damage, our innate intelligence does everything possible to keep us alive. It is not thinking about health. It's trying to keep us alive. Does that make sense? It's a difference between alive and health is secondary. In order to correct the acidity, the innate intelligence will dump alkalizing materials into the bloodstream, including magnesium and calcium. So let me make sure you understand this. If your blood pH is supposed to be 7.365 and you're putting things into your body that are creating an acid environment and is dropping below that 7.365, your body has got to get some minerals from somewhere to bring that alkalinity back up. Where is it going to find magnesium in the body? Does anyone have any ideas? Sandra? Well, not magnesium. It gets the calcium from bones. You're absolutely correct. It's going to grab the calcium from the bones. Magnesium is actually coming mostly from smooth muscle. Smooth muscle is what the muscles that are around the blood vessels or that make up the blood vessels, the heart, all those involuntary muscles, that's smooth muscle. So is that a good thing that it's stealing magnesium and calcium from those organs? Well, it's keeping you alive. It's keeping you alive, but health is secondary. When acid levels are chronically elevated due to poor dietary choices, the reserves of magnesium and calcium are depleted from those sources, bones and a smooth muscle, and the innate intelligence is forced to take calcium out of the bone, which is what? Osteoporosis. And magnesium out of the smooth muscle, which is going to give you muscle cramps, constricted blood vessels, and high blood pressure. Wow. So, high blood pressure, as Bob found out earlier this year, high blood pressure is affected when you have an arc of life, or that arc of life disappears or is reduced. And next week, our workshop is on the arc of life. We're going to be talking about specific strategies to help bring that arc back. But even if you bring that arc back, if you have an acidity problem, the blood pressure is going to be a problem for you. This is adaptation to a pathological environment, not disease due to genetically caused pathological physiology. In other words, what does that mean? Well, your body adapts. Your body adapts when you make unwise choices. Now, some people tell me, well, I don't want to make that healthy lifestyle choice. They come to me with some kind of a symptom, and they say, that's too much for me. Okay, but it's your choice. And until you make that choice, you will still be dealing with the effects of that choice. It's natural law, period. If someone has high blood pressure because of acidity, is this sickness or is this adaptation? It's adaptation. It's an adaptation from innate intelligence. It's normal. It's not healthy, but it's normal because, again, it's trying to keep us alive. Acid is stored in the fat cells, and then the body will actually purposefully increase the fat cells in order to try to store some of the excess acid. This is merely a protective mechanism. We're going to talk a little bit more about that in a moment. Imbalance in the blood pH leads to irritation and inflammation and sets the stage for sickness. So if somebody has chronic pain, and that chronic pain is just there all the time, and no matter what they seem to do, even if you're getting adjusted and that pain's still there, well, we have to look, what kind of things are we doing that are causing inflammation? And it's usually in the food, in the diet. Acute or recurrent illnesses result from either the body trying to mobilize the mineral reserves, again from calcium and magnesium, to prevent cellular breakdown, or emergency attempts to detoxify the body based on the imbalance. The body may throw off acids through the skin, producing symptoms such as eczema, acne, boils, headaches, muscle cramps, soreness, swelling, irritation, inflammation, and general aches and pains. Now, a moment ago, there was a slide up there that talked about the fat cells. When there's too much acid, the body has a wonderful protective mechanism to keep you alive, and it's called fat. Because what happens is the fat cells are there to literally cover, the acid literally goes into the fat, and it's to protect so that it's not as toxic. The fat helps to neutralize the negative effects. So this is, some of you know, have met Carolyn. She came to one of our workshops earlier in the year where we talked about ideal protein. Now, the picture there on the left is her back in August of 2009. This is a picture that she emailed to me today. She's half the person she used to be. She used to weigh 263 pounds. Now she's 132. Now what she did is she did the same thing that some of you in here are doing. Ideal Protein is something that we started back in April, and Diana's been doing it since April. Some of you others are on it as well. What I love about it, though, is it's a way to teach you how to eat differently. It's not a starvation diet. Now, we're going to be having a workshop in a couple of weeks more in detail about how that works. But the bottom line is the reason why calorie counting diets simply don't work is because it puts you into starvation mode. And if you're still acidic, the fat doesn't want to leave because it's trying to keep you alive. And so it's virtually impossible to lose weight. So by doing something that's natural, like Ideal Protein, which is simply allowing you to eat a ton of raw vegetables, and of course you're going to be very healthy because of that, and getting some healthy protein, it gets you out of that acidic state. That's part of the way how that works, and you get healthy, and of course you lose weight. And bottom line is, it simply works. When we have created an acidic environment, we are promoting microform growth. For simplicity purposes, for tonight, I'm going to simply call microform growth bacteria. So, microforms or bacteria thrive in acidity. Pathogenic microforms, not the healthy normal flora. Healthy normal flora will not thrive, will not stay alive in an acidic environment. On top of that, the waste that they produce are also strong acids. So you got a double whammy. You got the acid that's allowing the microform to grow, and then they produce their toxic materials, their waste, and it makes you even more acidic. It's a double-edged sword. So your body has both good and bad bacteria in it, doesn't it? So when somebody gets sick and they have bad bacteria, what do the medical doctors say to do? Take an antibiotic. Is that natural? If it's happening because of an acidic environment, then what's going to happen when you take that antibiotic? It's going to it's going to kill all the bacteria first of all, and it's not going to make you healthy. Healthy microforms are a huge part of keeping ourselves healthy. You must have those healthy microforms. Our normal, healthy flora have adapted with us. Now, these healthy microforms are called probiotics. You've probably heard of them. We were genetically designed to eat an alkaline diet. One of the biggest problems facing our society is that we chronically eat an acidic diet. As we ate alkaline diets, our healthy flora have adapted to alkalinity. When we become acidic, the healthy flora, probiotics, die, and the unhealthy bad bacteria actually thrive. Rudolf Virchow, he was one of the early influencers in modern medicine. He says, mosquitoes seek the stagnant water, but do not cause the pool to become stagnant. So if there's a sick environment, well, the germs aren't what caused the disease. They just found the poor environment that allowed them to thrive, and there they are. I want to be really clear. We can't catch disease. We simply don't catch disease. It's not just something that happens. It's not bad luck. It's not bad germs. It's not bad genes. We create the environment that allows the sickness or disease to thrive, and it destroys our health. Many symptoms associated with microforms, the bad bacteria, sneezing, runny nose, fever, are the body's most intelligent defense mechanisms. The body is willing to be very uncomfortable in order to kill or expel the species of unwanted microforms. Microform overgrowth creates toxicity and deficiency and will cause non-homeostatic, non-balanced cell function, which will cause illness if it is present. Now, there are some general signs that your body will have if you have microform overgrowth, and it's a long list. So, you ready? Diabetes, cancer, atherosclerosis, osteoporosis, chronic fatigue, pain, infection, fatigue, adrenal thyroid failure, indigestion, diarrhea, food cravings, intestinal pain, depression, hyperactivity, antisocial behavior, asthma, hemorrhoids, colds and flu, respiratory problems, endometriosis, dry skin and itching, thrush, receding gums, finger, toenail fungus, dizziness, joint pain, bad breath, ulcers, colitis, heartburn, dry mouth, PMS, and menstrual problems. Irritability, puffy eyes, lack of sex drive, skin rash and hives, lupus, mood swings, hormonal imbalance, vaginal yeast infections, cysts and tumors, rheumatoid arthritis, numbness, hay fever, acne, gas, bloating, bowel stasis, low blood sugar, hiatal hernia, headaches, lethargy, laziness, insomnia, suicidal tendencies, coldness, shakiness, infections, over and underweight conditions, chemical sensitivity, poor memory, muscle aches, allergies, burning eyes, multiple sclerosis, malabsorption, and bladder infections. Yeah, exactly. Whew. I want to be really clear. Microform overgrowth is not the sole cause of all those sicknesses and diseases, but it's overwhelming research that shows it is a major problem, a major cause. So, if an acidic diet is so bad for you, then what does an alkaline do for you? Alkaline diet? An alkaline diet can prevent and treat osteoporosis, age-related muscle wasting, calcium nephrolithiasis, and sodium chloride-sensitive hypertension, improving exercise performance, treating infertility, slowing progression of age-related and disease-related renal insufficiency. In short, it's going to counteract all those negative things that we just talked about and give you more quality of life. What about the good bacteria or the microflora that we need for proper digestion? First of all, where do you get the normal microflora, the probiotics? Well, it comes from the foods that we eat. But due to the farming practices, it's very difficult to get enough probiotics from our foods due to the industrial farming. The normal microflora thrives in a slightly basic environment, 7.365 as we already talked about, and will aid in proper digestion. Bottom line is, if you're eating acidic foods, the opportunistic microform overgrowths take over and they create more garbage that's in the already stagnant pool. So bring on the mosquitoes. Does that make sense? The daily present age consumption of bacteria, alive or dead, is 1,000,000 times less than what was consumed by our Stone Age Paleolithic ancestors. This is most likely a disadvantage because these bacteria have several documented functions in the body that are important for well-being, including but not limited to stimulation of the immune system, prevention of colonization by pathogenic microorganisms, and production of nutrients for the mucosa. What does all that mean? Try to keep us healthy. That's what that means. The bacteria that we're talking about are the probiotics, and because we simply can't get them from our diets, it's one of those necessary supplements that we take. If you're not taking the probiotics, talk to somebody on our staff. We can help you with that as well. It's important, like every supplement, to take quality. You can take garbage. Now, the GI tract must be able to digest food into components and absorb nutrients of potential benefit to the body, and at the same time eliminate components with potential risk to health. Normal microflora, probiotics, are what accomplishes this and plays a key role in immunity. So if you get sick frequently, one of the factors very well could be your gut bacteria. Frequently, people ask me this question when I talk about this. Okay, so can I get all of my healthy normal flora, the probiotics, from eating some yogurt? Makes sense, right? There are probiotics in yogurt. One strain. There's one strain of probiotics in yogurt. So it's impossible to get all of the multiple strains of probiotics that you need just from eating yogurt. And of course, you're eating the dairy, which is actually causing acidity as well. Although non-adhesive bacteria do have some functions during the passage through the GI tract, it is only from the adherent bacteria that real health-promoting effects can be expected. In general, common dairy bacteria used in the past for microbial replacement therapy are non-adhesive. So, bottom line is, we just simply need to take probiotics. What else is going to destroy our normal flora? The indigenous flora seem to play a key role in preventive functions. In contrast, it has become increasingly evident that many pharmaceutical drugs used today often induce increased intestinal permeability and contribute to gut leakage. This is one more example of how the allopathic paradigm of treating symptoms instead of restoring health can consider a decrease in symptoms, even with a corresponding decrease in health, a successful and scientific result. Less health, more suffering, and preventable death, perhaps with less symptoms due to drugs, is the inevitable outcome of this approach. Just like high cholesterol, you take a cholesterol-lowering drug, it's been proven, does not affect positively mortality rate. In fact, the research shows that the mortality rate goes up, but people are dying with lower cholesterol. Woohoo! That's successful science, isn't it? The secretion of salivary and GI mucus is often significantly reduced in disease, and through the use of pharmaceuticals, the production of mucus is significantly increased with increased consumption of dietary fibers, food. Soluble fibers, prebiotics, constitute an important source for bacterial fermentation, from which products such as hydrogen, methane, carbon dioxide, and short-chain fatty acids are produced. These fermentation products influence glucose and fat metabolism, reduce post-meal glycemia, and reduce serum concentration of free fatty acids and cholesterol. As a result of fiber consumption, the proliferation of mucosal cells increases and acidity decreases significantly. What does all that mean? In other words, soluble fiber will support GI health by helping to maintain normal, healthy microflora. The problem is, most of us have destroyed all our microflora by the foods that we eat. Or they might be more appropriately called non-foods. So how do we rebuild it? Well, an increase is in healthy normal flora with ingestion of vegetable and plant saccharides. We need to eat fruits and vegetables to feed ourselves and our bacteria. Bottom line is, when we eat close to nature, we will have health. When we eat far away from nature, if it comes from a box, it's far removed from health. I have another patient. She was telling me about some psoriasis issues that she had, and she had some other issues, and she has several problems. But bottom line is, I was telling her, you know, she's getting adjusted. She's got a lot going for her, but she's eating some acidic foods. And she says, as soon as I said, well, I have some advice for you, she says, oh, wait a minute, you're not going to tell me to eat vegetables, are you? And I says, no, I guess I won't. Consumption of fresh, unprocessed plant foods which contain free monosaccharides and polysaccharide fibers is strongly correlated with numerous health benefits, including protection from diabetes, heart disease, and cancer. Again, fresh fruits, vegetables reduce disease. Just as we are what we eat, plants are what plants eat. If plants cannot eat what they were genetically designed to eat because of industrial farming practices, depleted soil, and chemicals, they will, of course, develop deficiencies. So if they are deficient, how can we be sufficient? We must supplement with probiotics because in order for the probiotics. Also, that's why a good, healthy multivitamin is also very, very important for our good health. Create an alkaline environment in order for the probiotics to be effective. If you're too acidic, you'll kill most of the probiotics and get less benefit. So create an alkaline environment before you start taking the probiotics. I mean, if you're just slightly acidic, it's okay to start taking them. If you're really acidic, you're wasting your money buying the probiotics. Get alkaline first and then build up the good bacteria. Invest in some pH paper and check your fasting pH every morning and strive to become alkaline. So here's what you do. We have these pH strips. It's a little spool, and there's a ton, I don't know how many feet of pH paper that's on each spool. You tear off just a little teeny piece, and first thing in the morning when you go to the bathroom, urinate on it. And then you simply get that and you compare it to the color chart that's on the little spool. And then you'll be able to see if you're acidic or if you're alkaline. I recommend that if you're, do it once, and if you're acidic, Well, I recommend everybody do it once and do it consistently for at least a week, probably realistic 30 days, because you need to see trends, not just what it is based on you ate. But when you take it at fasting level, it's pretty accurate on what's actually going on inside of your body. For example, throughout the day, I can eat apples and and raw vegetables and lots of good healthy things. I can take some vitamin C, and it helps. And if I urinate on it, it will be very alkaline. It'll be healthy. But when I go to bed and I drink water and I wake up in the morning and it's acidic, that's what's naturally going on. So in other words, what I'm getting the readings during the day is because of what I'm eating, which is a good thing, because eventually you eat enough of that, it's gonna make your whole body very alkaline. So that's why it's important to do that fasting. We have some pH paper available. For those of you who are on the wellness certification, you may talk to Diana or Tina or Brianna. You can get your spool. It's already been paid for. That's what you get from your wellness certification. Those of you who are not on the wellness certification, it's $10 for a spool that will last you probably 6 or 8 months, or maybe even longer if you don't do it all the time. And so I encourage you to just check it out and start measuring. Also, some time ago, I checked the pH of the water in Rio Rancho, and guess what I found? It's acidic. So I encourage you with your strips, measure the water that you're drinking and make sure that you're getting alkaline water. And if you're not, do something to change that. Here's another really good resource, the pH Miracle. Some of you have already read this. It is on the Wellness Certification book list. You will get a wealth of information from that. Oftentimes, moms and dads ask me, what do you do for Halloween? Well, I want to share what I did. We couldn't find a picture of this today. I wanted to show it to you, but it was really cute. About 2 years ago, well, it was 3 years ago, because it was the year that Aaron was born, my last son. And he was born on October 21st, right before Halloween. And I had to struggle there to remember the date, sorry. I have 9 to remember, but I remember them all. They were all beautiful experiences, but when Aaron was born, my wife, she didn't really feel like doing our typical Halloween ritual. And people ask me all the time, what do you do for Halloween? You don't like candy. I didn't really touch on that, but if you didn't get the idea, candy, sugar, it causes an acidic environment. So we created a ritual many years ago, and most years we did it. Some years we deviated. Some of my kids really wanted to go trick-or-treating. 3 years ago was just absolutely awesome, because all my kids decided that we wanted to dress up like Dalmatians. And we were 10. Well, actually, at the time, I guess we would have been 9, because Mom and Aaron didn't go. So whatever the math turns out to be, we went out to dinner, dressed up as Dalmatians. And you need to understand something. At the time, it would have been 8 children. It would have been 7 children. It would have been 7 children at the time. With 7 children, and you go into a public place, do you think people might look at us? Well, my goodness, we turn heads all the time. People, oh my goodness, are all those your kids? And we get lots of really cool positive comments. And we tell our kids when we're in the van before we get out, okay guys, we're going into public, be nice to each other. But we get out of the van, and they're all dressed up in these white pants and shirts with spots on them, and they got dog ears, the spots, and it was so cute. We went into this restaurant, we sat down and we ate, and everybody would come over with their cameras. Can I just take a picture of you guys? That's our ritual. We get to take our kids out to dinner. With as big a family as we have, we don't take our family out to dinner very often. It's a treat for my kids, but it's a special treat when they get to dress up like that and everybody gets to notice them and they feel so special. It can happen. You don't have to go out trick-or-treating and getting all the candy and garbage. This year, just so you know, we're dressing up as superheroes. And I'm going to be Captain Cairo. Thank you for coming tonight.
Well, thank you for watching. Here's this week's homework. You've learned a lot about sugar and the acid-base balance and how that sugar will create acidity in your body. And there are other foods that create acidity as well. Well, your homework for this week is to just simply decide if you're already eating sugar and you've realized that you're probably eating too much, well, just transition to eating less sugar. Now, not just less as in I'll eat a little bit less each day, but go a day without eating any sugar. And then eventually get to where you're eating no sugar for 2 days, 3 days, 4 days, 5 days. Give yourself one cheat day where it's okay. Usually 1 day a week, that's where I'll say, you know what, I can let my hair down and I'll eat some. But I eat wisely during that time. I don't feel guilty, I just eat wisely. Because I know that when I do, there are consequences. When I do eat that sugar, I have to deal with those natural consequences. So hopefully by now, you can make that decision to just decrease the amount of days that you have sugar into your body. And of course that goes for all the different types of foods that contain sugar. Eat more naturally and then just give yourself that one cheat day. Try it for a month and see how much better you feel. And if you enjoyed this workshop today, look for one of our other workshops entitled Banish the Pancreas Blues, Understanding the Insulin Response. In that workshop, we talk about why not just diabetics need to be concerned about the insulin and the blood glucose, but it's something that everybody should be aware of so we can preserve a long, healthy life. So until next time, live your life to the fullest.